James, what's wrong?
Got a migraine.
Is it a migraine or a headache?
I don't know the difference, but maybe you will if you watch the next 50 Shades of Pain show coming up soon.
Hi, welcome to the 50 Shades of Pain show, where we empower our community with knowledge about pain, both physical and emotional, to give you the tools that you need for better health. I'm Dr. Donish, the medical director here at Wellward, and I'm here with my co-host, Dr. James Escaloni.
Who's now headache-free.
We're talking about headaches versus migraines. What's the difference? I usually split the two into very basic explanations. So a migraine, I think of taking place within the skull, whereas a headache takes place outside of the skull. And what I mean by that is, if you look at how our brain is cushioned inside of our head, it's a big, squishy, spongy brain sitting inside of a fluid-filled water balloon. And that water balloon is really where I believe headaches or migraines originate, because the skin outside of that water balloon is very, very sensitive. And a lot of processes, metabolic processes, stress, hormones, anything that is chemically oriented within the brain can irritate that water balloon skin and cause a migraine. Whereas a headache is something that starts outside of the head, and it can happen for many different reasons. You can have frontal headaches from trigeminal neuralgia. It's a nerve irritation that goes into the face. I've seen a lot of patients with headaches that come from jaws or
Your
even
temporomandibular joint.
exactly your TMJ, as they call it, can be irritated, which can cause that same kind of trigeminal-like headache, because the nerves that convey the signals from this are also conveying the signals from the rest of the head. And if it hurts here, that can bleed over, and not literally bleed over, but it can be processed in the spinal cord as pain that's coming from a wider area than just that joint.
Now, also, one of the areas that can be a problem is actually further down in your spine, your vertebra. And those are called cervicogenic headaches, meaning that the genesis of that headache's coming from your neck. Now, one of the challenges is if you've got a lot of problems coming from your neck that are causing pain, usually your neck is not moving very well. And that can make it so that your jaw sits a little bit differently to cause not only a cervicogenic headache at the neck, temporomandibular joint dysfunction with your jaw, and then trigeminal issues all at the same time.
That's why I see a lot of patients come in and they say, well, my headache usually starts back here, but then it encompasses the entirety of my head. It's because all of these things are connected, and it sets off a chain reaction that can evolve into multiple different headaches that overlap at the same time.
And I think that's one of the problems that people have if they're trying to get treated for headaches, that they see somebody who thinks headaches are only one of those things.
Right.
And they're not appreciating that it could be all of those at the same time. And not every single one of those gets the same treatment.
Absolutely. They're all very different. But I remember when I was training, there were three basic types of headaches. There's tension headaches, there's stress headaches, there's migraines, and that's about it. And now that we've really understood or dissected out the different causes of headaches, I find how different they are and how each one really responds to an entirely different type of treatment.
And that's why I think it's so important that when people are having these headaches, or maybe headaches that are not going away, that they need to see a practitioner or a group of practitioners who really understand the mechanics of the head, but also the physiology of the brain, all in the same practice.
Yeah, and we go through the HEAL methodology with all of our migraine patients. HEAL is our acronym, standing for hearing the message that your body's trying to convey with pain, envisioning what your goals are, alleviating some of the pain, and then leveraging repair mechanisms so that this doesn't become as much of a recurrent problem. But I would say the most important step in that whole process is really the first one, hearing the message that your body's conveying with pain, dissecting apart the origins of that headache to understand what is the chicken and what is the egg, where does the pain start, and how does that evolve to encompass the complexity of headaches that we see.
Yeah. So, Dr. Donish, could you give an example for the people out in viewer land? Somebody comes in and they've got headaches and it seems like everything's coming all over the place. Where do they even start if they came here for Wellward for relief?
Well, we would start with that process of really teasing apart the origins of pain. and numbing very discrete elements of the whole brain complex or the neck complex. So for instance, somebody comes in and they tell me I constantly have headaches in the back of my head. I'm going to start looking at the joints of the neck and seeing how well they're functioning. I'm going to examine and see where the focal points of pain are, but then we're going to use local anesthetic to numb those discrete parts and see how that pain evolves or changes, whether it's a reduction in frequency, reduction in intensity, or just an overall diminishing presence of pain or headaches until we can isolate where the origin is. And once we have that, then it's a process of figuring what treatments are going to get this to have a sustainable effect, whether it's numbing those nerves for a longer period of time, doing exercises and rehabilitation to better align the orientation of the neck, or to do some of the more advanced techniques like regenerative therapies that create stabilization or stability around structures that are weak and excessively mobile in order to create more stability and less frequency of headaches.
So what about if there's something going on in the brain with that stuff?
Yeah, there's a lot of nutritional things that we can look at. There are some new medications called anti-CGRP, which is an inflammatory chemical that accumulates in the brain. These are newer medications that can help migraines quite a bit. We used to only have a handful of different medications that can help with migraines, but now we've got this vast tool chest of different methods to not only look at the lifestyle things that are contributing, but also chemically modify the presence of what's the chemical soup in which that brain sits in.
That sounds like everything that could be causing some degree of a headache can be teased out pretty well, but it sounds like it's a complex issue.
It is. And if you've been dealing with headaches for a long time, you can start to adopt the notion that it's just not repairable or not improvable. But if you've lost hope for that, it's very difficult to re-invite that hope back into your life. However, I encourage you to do so because we really take a comprehensive approach to managing these issues, and every individual deserves that dedicated care.
Mm-hmm.
So you can find us on our YouTube page, our Facebook page, our Instagram page, our homepage, wellwordmed.com, or tune in to our podcasts, which is...
And we've got them on iHeartRadio, we've got them on iTunes, we've got it on Spotify, where you have free listening to a variety of topics. So we can actually teach you for free how to help out with subjects such as headaches, mental health, physical pain, and a lot more.
And if you have any specific questions or want us to talk about something in particular, please feel free to leave a comment below. We always read those and create new shows in order to meet your needs.
Thank you.
For everybody here at Wellword, I'm Dr. Donish.
And I'm Dr. Escaloni.
We'll see you soon.